What does a data breach mean to your patients? I'm Sarah Badaman, and this is the HIPAA Huddle. When a data breach occurs, hospitals jump into high gear to mitigate that breach. Oftentimes, there's one team working on mitigating the breach itself, while another team is doing the investigation. Things that the breach response team is going to be looking at include reputational, legal, financial, and even operational harm that could affect the hospital as a direct result of the breach. Hospitals oftentimes think about reputational and financial harm to their patients as well. Many times, credit monitoring is offered by the hospital to the patients to help protect their financial health. But one thing is missing. Patients are notoriously bad historians of their own health. So if hospitals aren't considering the risk of clinical harm to the patients during a data or security breach, it could cause real problems for the patients. Clinical problems that a patient could experience as a result of a complete record loss or even loss of access to patient records or diagnostic tests include misdiagnoses, delayed treatments, the wrong prescriptions being given, or even the wrong diagnostic tests being run. All of this could cause clinical harm to a patient during a breach. Although there's never been a documented case of a patient's death as a result of a data breach, there is a true risk of clinical harm to the patient. It is our responsibility as healthcare administrators and compliance professionals to ensure the continuation of care during a data breach or security incident to help mitigate any potential harm that a patient could experience as a direct result of that breach. Things we need to consider are a healthy contingency plan so that we can have healthy data backups to be able to get everything back up and running as quickly as possible after a breach. Potentially, we need to be able to have patient transfer plans in place in case we're not able to get everything back up as quickly as we would like to, so that patients don't experience any delayed treatments. In addition, we need to make sure that we have an effective emergency preparedness plan in place that includes a potential data breach or security incident that could cause a complete data loss or even loss of access to records for multiple days. Ensuring you have a multidisciplinary approach to your breach response teams as well as your contingency planning teams will help put you on the right path to not only protecting your hospital against harm, but also your patients against any potential clinical harm. These are just a few things that we need to be considering when we're looking through our breach response plans. If you have any questions, please reach out to me at sarah@hipaatruck.com. Thank you and happy HIPAA trucking.